A comprehensive set of driving regulations is being introduced across the United States in February 2026. If you are 65 years old or above, these new policies will directly affect your ability to keep your driver's license. Departments of motor vehicles throughout the country are rolling out updated testing requirements, medical certification processes, and license renewal procedures that specifically focus on senior drivers. Millions of Americans who have maintained safe driving records for decades could now face new challenges in keeping their licenses or may even risk losing their driving privileges completely. The decisions and actions you take in the coming weeks could determine whether you maintain your independence and mobility or lose the ability to drive altogether. These updates are not rumors or predictions. They are already being implemented and time is limited. Welcome back to Immigration Desk, your dependable source for vital information that impacts everyday life in the United States. From immigration updates to major regulatory changes affecting how you live, work, and move around the country, our mission is to provide clear, accurate details and practical guidance to help you protect your rights and make smart decisions. If you are new here, subscribe to Immigration Desk and turn on notifications because policy updates occur frequently and staying informed is your strongest protection. Today, we are discussing the new driving rules in the United States that will begin in February 2026, focusing especially on how these changes impact drivers aged 65 and above. Whether you are a senior driver yourself or have elderly family members, this information is crucial for preserving independence and ensuring safety on American roads. The first major change involves mandatory vision testing for all drivers aged 65 and older during every license renewal. Previously, many states required vision tests only for new drivers or occasionally during renewals. Starting February 2026, federal guidelines adopted nationwide require full vision examinations at every renewal period, which typically happens every 4 to 5 years in most states. However, 15 states are implementing stricter rules requiring testing every 2 years for drivers over 65 and yearly testing for those over 75. These updated vision exams go beyond basic eye chart reading. The new tests measure visual clarity at different distances, peripheral vision, depth perception, color recognition, and glare recovery. Many seniors who have safely driven for years are struggling with these enhanced tests due to normal age-related vision changes that may not necessarily affect real driving ability. Conditions such as cataracts, glaucoma, macular degeneration, and diabetic retinopathy, which are common among older adults, can negatively impact test results even when properly treated or corrected with lenses. Margaret from Ohio is a clear example. She is 72 years old and has driven without accidents for 54 years. She regularly drives to volunteer at church and visit her grandchildren. When she applied for license renewal in early February 2026, she failed the peripheral vision portion of the test due to mild glaucoma, which is controlled by medication. Despite her excellent driving history and confirmation from her ophthalmologist that her vision is safe for driving, her license was suspended until she completes a vision improvement program and passes retesting. She cannot drive for at least 90 days, which greatly affects her independence. The second significant change is mandatory cognitive testing for drivers aged 70 and older. This has become one of the most debated parts of the new rules. Beginning in February 2026, drivers in this age group must complete cognitive evaluations as part of their renewal process. These tests measure memory, reaction time, decision-making skills, and mental processing speed. The evaluation usually lasts between 30 and 45 minutes and is conducted by DMV staff or contracted medical professionals. The screening includes activities such as remembering number or image sequences, reacting to visual signals within time limits, following multiple instructions, and responding to simulated road situations displayed on computers. These tests aim to detect early symptoms of dementia, Alzheimer's disease, or other cognitive impairments that might reduce driving safety. However, many seniors find these tests stressful, confusing, and not an accurate representation of their driving ability. Anxiety, unfamiliarity with computer technology, language barriers, and testing environments can all influence performance. Robert from Arizona, who is 76, experienced this challenge recently. He has always driven safely in his retirement community and has never had an accident. During his computerized reaction test, he struggled with the unfamiliar digital format and time pressure. He failed the first screening and was referred for a neurological evaluation costing $850, which is not covered by Medicare. The appointment takes weeks to schedule, and during this time he cannot drive, making daily tasks difficult. The third major rule introduces mandatory road tests for seniors under certain conditions. While not required for all drivers over 65, these tests become compulsory if a senior has received a traffic ticket within the past 3 years, caused an accident within 5 years, or failed vision or cognitive tests, but wants to maintain a restricted license. Additionally, family members, doctors, or law enforcement officers can submit confidential concerns about a senior's driving ability, triggering mandatory road testing. These road tests are far more detailed than standard teenage driving tests. They include highway driving, parking exercises, complex intersection navigation, merging, lane changing, responding to emergency situations, and proper use of vehicle safety systems. The tests usually last between 45 minutes and 1 hour and follow strict scoring guidelines. Common failure reasons include incomplete stops, incorrect lane positioning, failure to check blind spots, overly cautious driving, and difficulty with parking or reversing. Dorothy from Florida received a small speeding ticket 18 months ago for driving 38 mph in a 30 mph zone. At 70, she now must complete a full road test to renew her license. She is extremely anxious because she has not taken a driving exam in over 50 years and is considering surrendering her license despite being a capable and safe driver. The fourth change introduces nighttime driving restrictions for seniors. Several states are implementing tiered restrictions that limit driving hours for older drivers. Starting February 2026, drivers aged 75 and older in 12 states will receive restricted licenses, preventing them from driving between sunset and sunrise unless they complete additional certification. This certification requires passing specialized nighttime vision testing and completing defensive driving courses focused on night driving challenges. The reasoning behind this policy is that nighttime driving presents higher risks for seniors due to reduced visibility, increased glare sensitivity, and slower reaction times. However, these restrictions greatly affect seniors living in northern states where sunset occurs early during winter months. William from Minnesota, aged 76, works part-time at a hardware store and finishes work at 6 p.m. During winter, it becomes dark by 5 p.m. Under the new rule, he cannot legally drive home. His employer cannot adjust his schedule, and public transport is unavailable in his rural area. He must choose between quitting his job or risking license suspension. The fifth major change requires annual medical certification for seniors with certain health conditions such as diabetes, heart disease, epilepsy, sleep apnea, stroke history, or conditions causing loss of consciousness. Drivers must obtain physician approval, confirming that their medical condition is controlled and safe for driving. While this appears to enhance safety, it creates financial and administrative burdens. Many doctors charge between $50 and $200 for completing certification forms, and insurance typically does not cover these costs. Some physicians also refuse to sign forms due to liability risks. Helen from Georgia has well-controlled type 2 diabetes and has safely driven for 43 years. However, her doctor's office recently adopted a policy refusing to complete DMV forms. She was referred to a specialist, charging $300 for evaluation, which is difficult to afford on her retirement income. The sixth rule shortens license renewal periods. Drivers aged 65 to 74 must renew every 4 years, those aged 75 to 84 every 2 years, and drivers aged 85 and older must renew annually. Each renewal requires completing all required tests, screenings, and medical certifications, along with paying renewal fees. This increased frequency creates financial strain and logistical challenges, especially for seniors with mobility limitations or limited transportation access. The seventh change requires mandatory reporting by healthcare providers. Doctors, optometrists, and other professionals must report patients over 65 who may be unsafe drivers. Failure to report can result in professional penalties. Although confidentiality protections exist, this rule changes doctor-patient relationships and may discourage seniors from discussing health concerns openly. Dr. Martinez, a geriatric physician in Texas, frequently faces this challenge. Some of his patients have mild cognitive decline, but still function independently and drive safely. Under new reporting rules, he must report them, potentially leading to license suspension, even though he understands the emotional and independence impact on his patients. The eighth change introduces technology requirements. Some states now require drivers over 70 to use vehicles equipped with backup cameras, lane departure warnings, automatic emergency braking, and blind spot monitoring. Drivers without these features may receive restricted licenses. This rule creates financial hardship for seniors who rely on older, paid-off vehicles. Retrofitting technology can cost thousands of dollars. Edward from Iowa drives a well-maintained 2012 sedan. At age 73, he relies on Social Security and a small pension. His vehicle lacks required safety features, and he cannot afford to upgrade. His only option is a restricted license limiting travel to local areas, preventing visits to his daughter and preferred medical specialists. The ninth change affects insurance policies. Insurance companies are adjusting rates and requirements based on these new testing rules. Seniors who fail screenings or receive restricted licenses often face higher premiums. Some insurers now require annual defensive driving courses or apply age-based surcharges. Rising insurance costs, combined with renewal fees and medical certification expenses, are forcing many seniors to give up driving due to financial pressure rather than safety concerns. The 10th major change involves the appeals process for license denial or restriction. While seniors still have the right to appeal, the process has become more complicated and expensive. Appeals may require hiring attorneys, obtaining independent medical evaluations, and attending administrative hearings. The process can take 6 months to 1 year, during which driving is prohibited. To prepare for these new rules, seniors age 65 and older should schedule comprehensive vision exams before renewal deadlines. Keeping prescriptions updated and addressing treatable vision conditions can improve test outcomes. Drivers age 70 and above should prepare for cognitive testing by becoming comfortable with computerized testing formats, getting proper rest, and consulting physicians about cognitive health if concerns exist. Maintaining a clean driving record is essential, as even minor violations can trigger mandatory road tests. Seniors with medical conditions should discuss DMV requirements with their physicians early and confirm willingness to complete necessary documentation. Considering vehicle safety upgrades, completing defensive driving courses, and discussing driving concerns with family members can also help seniors prepare. Exploring alternative transportation options such as ride-sharing services, public transit, and community transportation programs can reduce stress if driving privileges change. Understanding appeal rights and staying updated about regulatory developments is also important. Subscribe to Immigration Desk for continuous updates on how these rules are evolving across different states. These new senior driving regulations represent a major shift in transportation policy. Supporters argue they are necessary to maintain road safety as the senior population increases. Data indicates drivers over 75 have higher accident rates per mile compared to middle-aged drivers. However, critics argue age alone is not a reliable indicator of driving ability and that many seniors remain excellent drivers well into advanced age. Losing driving privileges can severely impact seniors by increasing isolation, depression, reduced healthcare access, and loss of independence. The regulations also raise concerns about fairness, particularly for seniors in rural areas or those with limited financial resources. Here at Immigration Desk, we understand that these regulations affect millions of seniors and their families. Independence and mobility are essential aspects of quality of life, and navigating these new requirements can be overwhelming. Our goal is to provide information that helps you understand your rights, meet requirements, and maintain driving privileges safely. If this video helped you understand the new senior driving rules beginning in February 2026, please like and share it with others who may benefit. Subscribe to Immigration Desk and enable notifications for updates as these regulations continue to develop across the United States. Share your experiences or concerns in the comments. Your voice helps others prepare and stay informed. Your independence matters, your mobility matters, your quality of life matters. Stay informed, prepare carefully, and stand for fair treatment under these new rules. This is Immigration Desk, committed to bringing you essential updates to help you navigate life in the United States. Drive safely and maintain independence for as long as possible. Additionally, many seniors feel the appeals system discourages them from challenging unfair decisions because of the high costs and long waiting periods. This makes preparation before testing even more important. What steps can seniors take to manage and prepare for these updated driving regulations? The first and most important step is scheduling a detailed eye examination well before license renewal deadlines. Visiting an eye specialist early gives seniors time to update prescriptions, treat conditions like cataracts, and improve overall test performance before visiting the DMV. Secondly, drivers aged 70 and older should mentally and practically prepare for cognitive testing. Becoming familiar with computer-based assessments can significantly improve comfort levels. Seniors should ensure they are well rested before testing appointments, maintain proper nutrition, and avoid unnecessary stress. If there are concerns about memory or reaction time, consulting a physician for early evaluation can help avoid surprises during official screening. Third, maintaining a strong and safe driving record is essential under the new regulations. Even small traffic violations can trigger mandatory road testing. Seniors should practice defensive driving, follow speed limits carefully, and stay alert to avoid citations. If a traffic ticket is received, attending traffic school when available can help prevent points from being added to a driving record. Fourth, seniors with medical conditions that require DMV clearance should speak with their physicians months before renewal deadlines. Confirming that doctors are willing to complete DMV documentation is critical. If a physician refuses due to liability concerns, seniors may need to locate specialists who perform driver fitness evaluations. Fifth, seniors should evaluate whether upgrading vehicle safety features is a worthwhile investment. Modern safety technologies such as lane assist, blind spot monitoring, and automatic emergency braking not only improve safety, but can also help seniors pass driving assessments. If financially possible, purchasing a newer vehicle equipped with advanced safety features may provide long-term benefits. Sixth, proactively enrolling in defensive driving courses can help seniors refresh their driving knowledge and reduce insurance costs. Many insurance companies offer discounts for completing these programs, and some states consider course completion when reviewing senior driver license renewals. Seventh, seniors should maintain open and honest discussions with family members about driving ability. While these conversations can be emotionally difficult, family feedback can help identify potential safety concerns early. Independent professional driving evaluations can provide objective assessments and help seniors understand their abilities realistically. Eighth, seniors should research alternative transportation options within their communities. Many areas offer senior transportation programs, volunteer driver services, ride-sharing options, and public transportation services. Having backup transportation plans reduces anxiety if driving privileges become restricted. Ninth, understanding legal rights in the appeals process is extremely important. Seniors who believe they were unfairly denied or restricted should gather medical documentation and consider consulting legal professionals specializing in DMV appeals. Taking action can sometimes restore driving privileges. 10th, seniors must stay updated on changes as these driving regulations continue to evolve. Rules vary between states, and some provisions are facing legal challenges. Staying connected with reliable information sources helps seniors stay prepared. Subscribe to Immigration Desk for consistent updates on regulatory changes affecting seniors across the United States. These new senior driving rules represent a major transformation in how states regulate older drivers. Supporters believe these policies are necessary to protect public road safety as the senior population continues to grow. Research shows that drivers over 75 statistically experience higher accident rates per mile compared to middle-aged drivers, and age-related declines in vision and reaction speed can impact driving ability. However, critics argue that applying restrictions purely based on age can be unfair and discriminatory. Driving ability varies greatly between individuals, and many seniors in their 70s, 80s, and even 90s continue to drive safely without posing risks to public safety. The loss of driving privileges can have serious consequences for seniors. Driving often provides access to healthcare appointments, grocery shopping, social gatherings, and daily independence. Seniors who lose licenses may experience social isolation, depression, declining physical health, and reduced quality of life. The implementation of these regulations also raises concerns about fairness and accessibility. Seniors living in rural communities without public transportation face greater hardship compared to those in urban areas. Low-income seniors may struggle to afford medical evaluations, new vehicles, or safety technology upgrades. Seniors with language barriers or limited education may also face difficulties with computerized testing systems. Here at Immigration Desk, we understand that these driving regulations affect millions of seniors and their families. Mobility and independence are essential for maintaining a strong quality of life. Navigating these new requirements can be stressful, but accurate information and preparation can make the process easier. If this information helped you understand the new senior driving regulations beginning in February 2026, please like this video and share it with seniors and families who need this knowledge. Subscribe to Immigration Desk if you have not already, and turn on notifications to receive updates as these rules continue to change across different states. Share your experiences or concerns in the comments section. Are you a senior facing these new requirements? Have you completed your license renewal successfully, or are you facing challenges? Your experience helps others understand what to expect and how to prepare. Your independence is important. Your ability to travel freely is important. Your overall quality of life is important. Stay informed, prepare carefully, and speak up for fair and balanced treatment under these new regulations. This is Immigration Desk, dedicated to providing essential information to help you navigate daily life in the United States. Drive safely and remain independent for as long as possible.